the maracas, I go chick, chicky, boom, chick, chicky, boom.
Welcome to No Laughing Matter with Cuba Pete, a show that takes a critical look at the disparities between medical school education and society's growing healthcare inequities. Join Dr. Pedro Cuba Pete Greer each episode as he interviews the experts working to transform medical education and ensuring that future doctors are trained to provide equitable and compassionate healthcare for all communities. Dr. Greer received the Presidential Medal of Freedom in 2009, honoring his dedication to providing health care to underserved populations. As Dean of Roseman University College of Medicine in Las Vegas, Dr. Greer is committed to creating a medical school of the future where students embrace the need to unite the heart and science of healthcare. And now, the host of No Laughing Matter with Cuba Pete, Dr. Pedro Cuba Pete here.
Well, welcome from the Summerlin campus of Roseman University College of Medicine. This is Cuba Pete, a podcast where we look at society and interactions and how that works with the medical education and health in general in our community. Today's a very special show, though. I'm here with a dear and old friend, collaborator and co-conspirator of mine, Dr. Lou Brewster. Lou and I met, my goodness, almost 20 years ago, or about 20 years ago, when we started on a mission to really reform medical education and do everything possible to improve the life of the most vulnerable. 20 years. Well, something remarkable has happened.
We're old.
Today, we are sitting in the newest medical school in the United States of America, Roseman University College of Medicine, with pioneering curriculum, and the idea is to make the world better. We're in a very interesting time in our country right now, where it looks like we're heading towards a recession. Well, the last medical school we started in the middle of a recession.
That's right.
And if you think it's tough on us, think of what it's like for those that are hourly workers or those that are fearing losing their jobs. But with that, I have the great pleasure and honor of introducing Dr. Brewster. Dr. Brewster is a person who I have great admiration for. He not only has committed his life to helping the most vulnerable, but how do you train an army for the future to take care of the most vulnerable, and why do you do that? He has done that in the most creative ways. He has worked for decades with John Lewis, our famous congressman, somebody who he knew personally, that I had the honor of meeting when he did the commencement at the Rand Corporation's graduate school. And when I went up to him and told him I was a friend of Lou's, his smile went from ear to ear and just said, "How is Lou?" I said, "Well, he's pretty much wrecking my life like he did yours, but besides that, he's doing well." His son just got a learner's permit for a car, right?
Yeah.
So we're lighting candles every day, as those of us that have gone through that for many years. But with that, Lou, let me ask you a question. Why do you do this?
Well,
What is it in your life? Why do you do this when you could have had the opportunity to go out there and make $1 gazillion?
well, believe it or not, I initially thought that was the path I wanted to go, and I did kind of follow it for a brief moment. Having a consulting firm in Harlem, and that was fun. I think what really turned it for me was I began to realize that the people I was truly helping in those communities were not the people who were paying me. And in a lot of ways, that's still the same. It's the people who pay me really not the ones that I'm helping as much as the people that they pay me to help. And then honestly, a lot of it has to do with I've just had enormously great mentors. Yourself, you mentioned Congressman Lewis. Congressman Lewis was a person who had character, no matter how busy he got, no matter what he was doing. If we have a moment, I want to share a story once. In my early 20s, I got very sick. I ended up in a coma for 2 weeks.
Wow.
And while in that coma, I somehow, some way, I think my parents got in touch with Congressman Lewis, who I was working with at the time, and he sent Congressman Lewis always had a staff minister, which was always interesting to me. His name was Albert Love, and Reverend Love. He told Reverend Love to come to my room every day and pray for me. not to come back until I had awakened. And my parents didn't know who he was, but he was there every day. And I never forgot that. So when people ask me about like my most memorable moment with Congressman Lewis, I always tell them that story that he didn't have to do that. Like I mean, I was just I was entry level worker. I was a legislative aide. I didn't do, I was one of many in his two offices because congressmen, they have at minimum two offices. They have a district office and they have a office on the Hill. And I was a district office, so I wasn't even on the Hill. And so for him to do that for me, to me was just tremendous. But it spoke volumes to the power of investing in people and not letting the people that work with you on your mission know that you care, and all those things bundled up together. I had tremendous parents. uh, I take myself to be as good a Catholic as I can be. It's a journey, as I'm sure you know as well.
Yeah. And the advantage of being Catholic is we can ask for forgiveness.
Exactly, exactly. And so I think all those things kind of bundled up. And then the last and probably most prominent is my family, right? I saw for no other reason but opportunity. I had a number of people in my family who could have achieved so much more in their lives, but just didn't have the opportunities. And quite honestly, that's no different than the families that we go visit, than sometimes the people that we hire. Everybody deserves to have somebody in their life walk into their life and tell them that I believe in you right now more than you believe in yourself, but I can help you get to a level where you'll outpace my belief in you, if you just put in the time and do the work and et cetera. And that, I had that through my parents, but suppose you didn't have those kind of parents, or suppose you didn't have parents at all. Where do you get that message from? Where do you get that encouragement and that reinforcement from? And so I just kind of see it as my path to doing that. And the funny thing is that I've been rewarded financially, in the grand scheme of things. I mean, I'm not a billionaire or anything like that, but I'm comfortable. I take care of my family and do well. So it paid off, sticking to my conviction. So I don't have any regrets in any way, shape, or form.
And more so for your son, London, because he gets to see you and your wife, Cheryl, and the work that you have committed your life to. And it's also interesting because Congressman Lewis was a man of deep faith. He was a reverend himself. And how important faith is in getting things done,
Oh,
but
absolutely.
when done for the right reason.
Well, but also being one not so convicted, to not hold such deep conviction that you can't challenge authority that you are right to, right? I remember when Congressman Lewis told me the story of him being the grand marshal of the Gay Pride Parade as a Baptist minister, deeply rooted in the South. That to me was crazy. I was like, like what, like at the time too. Yeah. This was not what it is today. Like that was a tremendous thing, and he didn't do it one year. He did it several years. And so at the disagreement of the Southern Baptist Convention and many others, but he did it anyway. So I think that you can still be a part of something.
And what was the reason he said he did it?
He said it because it was a human rights issue. And that's at the core of what he was about, right? And he doesn't get to pick and choose which human rights he's supportive of. And that part, of that's a lesson for us all, right? Like if you're rooted in healthcare for all,
It's healthcare for all.
it's healthcare for all, right? Like you don't get to pick and choose who's the healthcare for, right? And so I think unfortunately we have sometimes individuals who want to put an asterisk around all, or want to put an asterisk around human rights, and that's where we run into trouble, and because it creates a friction with us that we don't necessarily appreciate.
So we now have this accredited medical school with the opportunity to train the future workforce to really improve the healthcare of this community, of this nation, of this state, of this region. And this is the second medical school you and I put together. And one of the problems that we had with this was there's no definition of what a good doctor is. So how do you make a product without knowing how to get there? Well, I think what we did was, what is wrong with healthcare in our country? How do we train a future workforce to fill those gaps? One of them is we have to get character back in the profession. There was a recent article in the Wall Street Journal showing that physicians from 2021 to 2024 had the biggest drop in trust level in the country, from almost 70% to just a little above 50%. That was the biggest drop of any profession cited, even though it was still high, a little over 50. It is nothing compared to what it was at the turn of the millennium when it was in the 80s and 90s.
Yep.
So, knowing people are frustrated with the healthcare system, the front-facing person is still that physician, and they're pressured with the amount of time and all these different things that they can spend with a patient. And a lot of patients are beginning to feel that physicians aren't listening.
Yeah.
So how do we change that? Well, first and foremost, we do this, and we found this out by increasing empathy, and we do that with the program of household-centered care. Now, this was not a program designed by Lou that said, this is what I want for a medical school. This was a program that said, how do I get to the sickest, poorest patient before they show up at the clinic to improve their lives? And then we could teach students how these innovations are so important, and they have to look for these inefficiencies.
So Genesis is the name of the product, and I think that what we're ultimately trying to do is confront students' long-held beliefs and ideas about um, the patient population that they're charged to work with. That patient population is not oftentimes the one that they think that they know. And the reality is many of them don't even come from the communities that their patient populations are from. And so these
And these families make less than what their tuition payments are.
Exactly. And so it's very difficult at times to get a student to understand that there's a level of humility that you now must carry when you enter their home and they're not entering your office. And that part is that and faculty too, right? Our whole healthcare system is oriented around the power of the healthcare system and the almost belief that we're doing you a favor, not a service, and because of that, uh, a lot of what we see happen is being rooted in the power differential that exists between patients and providers, and so by bringing a person into the home, what we in essence are saying is that why don't you take a step back and play on their turf. I always use the example of how, like, with uh, when you're in a office setting and you ask a patient, what is do you have some type of infestation in your home? And the patient says, yes. You'll tick the box in the EHR and you'll keep moving. But when you have to do a home visit and you're sitting in that infestation of roaches or whatever, you don't tick a box any longer. Now you're activated to do something about it because you have to go back to that house in a couple of weeks. It's that kind of sensitivity to the issues that individuals are living under that wake you up to the fact that maybe I'm not being as urgent as I need to make this happen. And then reinforcing those themes with the great work that's being done here by some of the other senior executive deans, right? So, having Dr. Gillis lead the charge around ethics and what are the ethical considerations when you're doing home visits. Having a stellar medical curriculum. I always, whenever I'm asked about what is the role of doctors when it comes to social determinants of health, I always say the same thing: be great doctors.
Yep.
Like, do that first. Like, be a really high quality doctor. And so, Dr. Esposito, who is quite honestly, I can make a case that she's one of the major contributors to why this medical school got accredited.
Yes.
Which, if people want to know the secret to starting a medical school, hire a German psychiatrist.
That's right.
There you go. Right. And so, being able to give them core skills and be strong at your craft is just as important as having a understanding of the social conditions of individuals. And
Well, the social conditions influence the disease.
It does. It does.
and the therapeutic intervention. So without knowing that, you can't be the best clinician.
And so I guess if I have to choose one, um, I'm going to say be a great clinician because that's the entryway to building trust with the patient, right? People want to know that you have two things combined: competence and character, right?
And make the patient feel that they are the most important.
Absolutely, absolutely, and so I think that's at the core of it, and then we surround them with a team of community health workers who do the work when the students are unavailable, they're taking exams, etc. So that there's continuity in the experience of being treated well, even when the students aren't available, the faculty aren't available. Um, Being out in the community, doing community outreach events, sometimes jointly with the students, is a way of also showing that one of the biggest things you want to do is show up, right? People have problems, and if you say you're committed, then you're more than just committed to the couple hundred households you may be seeing. You're also committed to the broader community as well. And so all of those things I think wrapped together is what makes us unique.
So just imagine Las Vegas gets a new medical school, and a new medical school that concentrates its education and delivery system to the most vulnerable in society. So we're not only improving the lives of people, we're saving Las Vegas money.
Saving Las Vegas money, you can get more um, deliberate about that and say saving the hospitals money here locally, saving potentially the school systems, the all the other systems that we have a soft touch to in providing assistance to the families that we work with. And then the long term benefit is that we truly expect that some of these individuals that we went to visit will one day become physicians at our medical school, trained at our medical school, and so um, that now gives you a plus 100 of sorts in the benefit that it will yield. And I used to point back to our work in South Florida and say, hey, we've done it before, but we no longer have to do that because we've been doing this now for 3 years here in Las Vegas. We don't have to point to another city. We can point to what we've already done here in Las Vegas, and that part is really cool.
That is super cool. As a matter of fact, we have an open house today.
We have an open house today for our community partners. 60 plus community organizations are going to be showing up today to learn more about Genesis, learn how they can engage with us even more. We host these so that partners can learn new opportunities that we're offering, new things that we're doing in the community, new ways that we're benefiting the community.
How many households do we have?
So currently we have around 200 plus households, if I remember correctly. And so by the time we get full going with all 4 years of students, we will be at a couple thousand households.
There's a couple thousand households that get health care, primary care, mental health, identifying, mitigating social determinants, and they have somebody that they can turn to.
And preventive health. And preventive health. We do some work in partnership with the College of Pharmacy, Dr. Oswald, where we do some heart health work, stroke prevention, diabetes prevention. And so this is growing every day. We after a while won't even be able to contain all of the different areas. We're in talks right now with the state of Nevada's Department of Public Health to expand the reach of our services to be statewide, and looking at what that looks like. So I'm talking about a couple thousand households, and I'm just talking about Southern Nevada, just the Las Vegas area. Who knows what it'll ultimately turn out to by the time we get to providing statewide services.
So with the Genesis program, not only do we improve the lives of an entire household, but we have a student that actually follows a family for 4 years, as opposed to a 6 or an 8 week
Two
rotation.
families.
Two families.
And um, the goal there is that they will interact with those households, and improve the health and social condition of those households. But while they're simultaneously learning about some of the policy implications of the work they're doing, some of the advocacy implications of the work they're doing, how this work overlaps with the things that they're learning as far as core skills around um, uh, uh, even taking a patient history and things of that nature. So it's all overlapping. We're not this separate program off in the corner at the College of Medicine. We are embedded into the curriculum. We have structured time within the curriculum. Dr. Steve Embley, who is our chief medical operator for Genesis, as well as the lead in the curriculum, has done a marvelous job of making sure that the two teams merge together, that the curriculum is seamless in getting students to understand that these aren't separate ideas that we're talking about, that these are ideas that go hand in hand to improve the quality of care that patients deserve to receive.
100%. Lou, thank you for creating this incredibly unique and innovative teaching system, as well as a system that actually improves the health of a community.
Well, I want to say that this is impossible without Shayla Pierre. Shayla,
Go, Shayla.
yeah, Shayla worked with me in South Florida, and she took the courageous risk to come out here and trust two crazy people to do this
Well,
project.
we promised her beachfront.
Yeah, just no
Ocean.
it's no order. And so I attribute, all of the success that we're seeing to Shayla and the great work she's done around recruiting the team, training the team, making sure that we stay on mission. She affords us the ability to do this in a way that I don't think I ever could. And that's the beauty of this, right? Like you hope that, when we finally get in a rocking chair and smoke cigars, that there'll be someone who can carry on and do this work. And
I'm Cuban. I have to smoke cigars. It's not that I want to.
but but you got to get that you have to get that opportunity now. You can't wait for it to happen. You have to empower them to take on that role and do it. And Shayla is the quintessential example of how the future looks bright.
Not just a great leader, but a brilliant young woman. She
Absolutely. And so I'm pleased with everybody on the team, but I would be remiss if I didn't highlight the incredible work that she's done. And I hear it from everyone who, when I'm out and about in the community,
same thing.
I hear it all the
Same
time.
thing.
I hear nothing but positive things. So I always want to make sure that I highlight the great work that she's done.
Because the beauty of what Lou does is the ownership that we take in this is you, the patient, own this. We're here to serve you. And, as we create this medical school, now that we're officially accredited and applications are open,
Mm-hmm.
and we have other programs we want to highlight. One of them is we're pioneering a curriculum based on character. And I'll have Dr. Gillis come here and present what we're doing with that. We have a sign outside the dean's office by C.S. Lewis that says, "True humility is not thinking less of yourself, it's thinking of yourself less."
Mm-hmm.
Let's go forward with the confidence to make this world better and the insecurity, always know that the responsibility we have is great. Well, congratulations to us.
Yeah. You always hear people want the best and the brightest. I think here we want the best and the kindest.
That's it. Yeah.
And so if we can get that, that's the kind of student and the faculty and et cetera we're looking for.
And just remember the motto that we brought here: what happens in Vegas, we want the world to know. And with that, from the studio in Summerlin on the campus of Roseman University College of Medicine, Dr. Luther Brewster and myself, Joe Greer, let's make the world better.
If you enjoyed today's podcast, please subscribe, like, and comment on your favorite podcast platform. If you'd like to support the groundbreaking work that Dr. Greer is doing at the Roseman University College of Medicine, please donate at the link below. Thanks for tuning in to No Laughing Matter with Cuba Pete, as together we work to unite the heart and science of healthcare to serve all in our communities. See you next time.